Your feet are trying to tell you something right now, and most people completely ignore it. Not because they don't care about their health, but because nobody ever told them what to look for. I'm going to change that today. I'm Dr. Adriana Markson, and what I'm about to show you is something I see confirmed in my exam room every single week. Warning signs of high blood sugar that show up on your feet, long before any blood test ever catches it. Just last month, I sat down with a patient, a 69-year-old woman named Margaret. Retired teacher, active, felt perfectly fine. She came in for a routine visit. Before we ran a single test, I asked her to take off her shoes. She had 4 of the 9 signs I'm going to walk you through today. Her fasting blood sugar came back at 219. She had been diabetic for over 2 years and had absolutely no idea. So today, I want to show you exactly what I showed Margaret. 9 warning signs already visible on her feet and on millions of feet right now that almost nobody recognizes for what they are. For each one, I'll tell you what most people assume it is, what's actually happening inside the body, and one simple daily habit that can protect you. Here's the number that stops me cold. The CDC estimates that more than 8 million Americans are walking around right now with undiagnosed diabetes, silently damaging their nerves, their kidneys, their vision, and especially their feet. The good news? A $12 blood test can catch this early. But first, you need to know what you're looking at. Let's get into it. Sign number 1 is something nearly every patient has already experienced, and every single one of them has explained away. Tingling. Numbness. That pins and needles sensation in your feet. Patients tell me, Dr. Markson, my foot just falls asleep sometimes. I sit funny at the kitchen table. And yes, that happens to everyone once in a while. But when I ask, is this happening regularly without any clear reason? That's when the conversation changes. Frequent, recurring numbness or tingling in the feet, doctors call it peripheral neuropathy, is one of the earliest signs that blood sugar has been elevated for some time. Here's what's actually happening. Excess sugar in your bloodstream slowly attacks the outer protective coating of your nerves. Think of your nerves like fiber optic cables running from your brain to your toes. Those cables have a protective outer layer that keeps the signal clean. When blood sugar stays high, it's like a slow chemical drip eating through that coating. The cable still works for a while, but the signals start getting garbled. That garbling is the tingling you feel. Research from the American Diabetes Association confirms that peripheral neuropathy affects nearly half of all people with diabetes, and it almost always starts in the feet. Tens of millions of Americans are experiencing this right now and writing it off as nothing. My recommendation: a 20 to 30-minute walk every single day. Not a run, a walk. Movement keeps blood flowing to those nerve endings. And start cutting added sugar out of your diet today. Not next month. Today. Sign number 2 is the one my patients describe as the most disruptive because it doesn't bother them during the day. It hits them at 2 in the morning, in the dark, with nothing to take their mind off it. Burning in the soles of the feet, especially at night. Most people chalk it up to standing all day, summer heat, tired legs. And sometimes that's all it is. But when a patient tells me their feet feel like they're on fire the moment they lie down and go still, I take that very seriously. What's happening is this. The nerves in your feet have been damaged by excess sugar, and now they're sending wrong signals to your brain. Your brain receives a heat message, even though absolutely nothing hot is touching your foot. The nerves are misfiring. Imagine a smoke detector with a broken sensor. The building is perfectly fine, but the alarm keeps screaming anyway because the detector itself is damaged. Your nervous system is doing the same thing. The burning isn't coming from outside your body. It's coming from inside, damaged nerve tissue that is crying out for help. Research published in the journal Diabetes Care found that burning foot pain is one of the first reported symptoms in patients later diagnosed with type 2 diabetes, often showing up 1 to 3 years before a formal diagnosis. 2 habits I recommend here. First, 8 glasses of water every day. Proper hydration helps your kidneys flush excess glucose and supports the nerve tissue itself. Second, add more fiber to every single meal. Vegetables, beans, oats. Fiber slows how quickly sugar enters your bloodstream. And that is exactly what those struggling nerves need. Sign number 3. I need you to pay close attention here, because this is the one that stops being uncomfortable and starts becoming genuinely dangerous. This is the sign that sends the most patients to the emergency room. They come in and say, "Dr. Markson, I had a little blister from my walking shoe about 3 weeks ago. It still hasn't closed up." They waited. They assumed it would heal on its own. Most small wounds do heal on their own, but not when blood sugar is elevated. When glucose levels stay consistently high, your body loses its ability to repair itself efficiently. The tiny blood vessels in your feet begin to narrow and stiffen. That means the oxygen, the white blood cells, the nutrients that close a wound, simply cannot get there fast enough. The wound sits open, vulnerable, waiting. Think of it like trying to water a garden through a hose that's badly kinked. The water exists, it just can't reach the plants. That's exactly what high blood sugar does to circulation in your feet. Everything your body needs to heal is in your blood. It just can't arrive on time. And an open wound that won't close is an infection waiting to happen. The CDC reports that diabetic foot ulcers are the leading cause of non-traumatic leg amputations in the United States, more than 100,000 every year. Nearly all of them started as a small wound that was ignored. Tonight, after your shower, sit down, good light, and look at both feet. Check between every toe. Check your heels. If you find any cut, blister, or broken skin, clean it, apply antiseptic, cover it. And if it hasn't clearly improved within 48 hours, call your doctor. Not next week. 48 hours. Sign number 4 is hiding in plain sight, and most people walk right past it every single day. Patients notice their skin turning darker or more reddish around the ankles. And they tell me, "Oh, that's just sun damage, I've always had that." Maybe, but there's a specific pattern of discoloration around the ankles and lower legs that I watch for very carefully when I'm assessing blood sugar risk. When circulation is compromised by high blood sugar, the lower legs and feet stop receiving enough fresh, oxygenated blood. The skin reflects that. It shifts toward dark red, sometimes a deep reddish brown, occasionally even a faint bluish tint around the ankles. In some patients, the skin in those areas becomes noticeably thinner and more fragile, too. Both are signs that the tissue is being starved. I explain it to patients this way. Think of your blood as a delivery truck bringing oxygen and nutrients to every part of your body. Your feet are at the absolute end of the longest delivery route, further from your heart than anywhere else. When the roads narrow because of blood vessel damage, the deliveries stop arriving on time. The skin, deprived of oxygen, changes color. It's a distress signal you can actually see with your own eyes, if you know what you're looking at. A study in the Journal of the American Academy of Dermatology found these visible skin changes appear on average 18 months before a diabetes diagnosis. My recommendation: 5 minutes of ankle circles, toe raises, and calf stretches every morning. Even that small amount of movement drives fresh blood down into your feet. And if you're sitting for long periods, elevating your feet just a few inches makes a real difference. Sign number 5 is the one that surprises my patients most because it looks completely harmless. Most people have had it for years and never once connected it to blood sugar. "Dr. Markson, my heels crack every winter. It's just dry skin." I hear that constantly. And yes, seasonal heel cracking is very common. But when your heels are deeply cracked in the middle of July, or you've been using every moisturizer on the shelf for a year with zero improvement, that is a completely different story. Diabetes damages what are called the autonomic nerves, the ones that quietly control the automatic functions your body handles without you ever thinking about it. One of those functions is regulating moisture and sweat in the skin. When these nerves are damaged, the sweat glands in your feet begin to shut down. Your feet lose their natural moisture from the inside out. No amount of lotion fixes that root cause. Think of your skin like a brick wall that needs mortar to stay sealed. When those autonomic nerves fail, the mortar crumbles. Cracks form. And those cracks in your heels aren't just cosmetic, they are open doors for bacteria. I had a patient, a 71-year-old man named Frank, who had been applying thick cream to his heels every night for almost 2 years. He came in with cracks so deep they were bleeding. He thought it was a skin problem. It wasn't. It was a nerve problem. The American Podiatric Medical Association identifies chronic, treatment-resistant heel cracking as a significant indicator of autonomic neuropathy, a condition directly tied to long-term elevated blood sugar. And autonomic neuropathy is not a minor inconvenience. It means your nervous system is under serious, ongoing stress. Moisturize your feet every night before bed. Good lotion or pure coconut oil works beautifully. Apply thoroughly to the sole and heel, but never between the toes. That trapped moisture breeds fungal infection. And drink your 8 glasses of water daily. Your skin needs hydration from the inside just as much as the outside. We're halfway through, and I want to ask you something directly. Have you noticed any of these signs in yourself or in someone you love? A partner, a parent, a sibling? If the answer is yes, even for one sign, go to the comments right now and type the word yes. Just that word. I read every single comment on this channel, and if you have a question, ask it. That is exactly why I'm here. And if this is useful to you, hit the like button right now. It takes 1 second, and it helps YouTube show this to more people who need it. Alright, let's keep going. Sign number 6 is more serious than most people realize because it's not just about your feet. It's about what's happening to your kidneys at the same time. Almost every patient I've seen with this tells me the same thing. I'm on my feet all day. The swelling is just from standing. And occasional swelling from activity is completely normal. I want to be clear about that. But if your feet and ankles are consistently puffy and you're peeling off your socks at the end of the day to find deep sock-line impressions that linger, that changes the picture entirely. Here's what's happening. High blood sugar, over time, damages the kidneys. And your kidneys are what regulate your body's fluid balance. When that filtration system is under stress, excess fluid accumulates in the lowest point of your body, your feet and ankles. This is called edema. Think of your kidneys as a water treatment plant for your entire body. Every drop of blood passes through them to be cleaned. When high blood sugar damages that plant, the system backs up. Fluid has nowhere to go, so gravity pulls it down. It pools in your ankles. If you press a finger into the swollen area and the indent stays there for a few seconds, that's called pitting edema. And that is not something to observe and forget. The National Kidney Foundation reports that diabetic kidney disease affects roughly 1 in 3 adults with diabetes, and visible lower leg swelling is frequently the first sign that kidney function is being compromised. When you're resting, elevate your feet above heart level, even just a few inches on a pillow. This helps pull accumulated fluid back toward the center of your body. And reduce your sodium intake. Salt causes the body to hold water, which makes edema dramatically worse. Check labels, canned soups, and processed foods are often loaded with it. If the swelling is new, worsening, or doesn't improve with elevation, please bring it to your doctor's attention at your next visit. Don't wait for it to become a bigger problem. Sign number 7 is the one I see most often misdiagnosed. And by the time patients figure out what's actually going on, they've been masking it with over-the-counter pain medication for months. I've been taking ibuprofen for this foot pain for a while now, Dr. Markson. I figured it was my old knee injury, or maybe arthritis. I've heard that story more times than I can count. A patient named Jim came in last spring, 72 years old, former contractor, tough guy, hadn't complained about anything in 20 years. He'd been managing foot pain with ibuprofen for 8 months before his wife finally convinced him to come in. Sometimes the pain really is arthritis, but sometimes the pain has a completely different origin, one that ibuprofen will never touch. When nerves are damaged by chronic high blood sugar, they don't always go quiet. Sometimes they go the opposite direction. They become hyperactive. Instead of going numb, they start firing random, intense signals. The brain interprets these as stabbing pain, electric shocks, a hot needle through the sole of the foot. It often hits hardest at night, when there are no other sensations competing for your attention. Think of a car alarm damaged in a minor accident. Every few minutes it starts screaming, even though nobody's touching the car. Nothing is wrong. The alarm itself is just broken. A damaged nerve does exactly that. It sends distress signals when there is no injury. The pain is completely real, but its source is nerve dysfunction, not an injury that ibuprofen can touch. And masking that signal, is the last thing you want to do when your nerves are trying to get your attention. A landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects roughly 1 in 4 people with diabetes and is routinely mistaken for arthritis or age-related joint pain. Each morning, spend 5 minutes doing gentle foot and ankle stretches before you put weight on your feet. Flex your feet, circle your ankles, gently pull your toes back. Get the blood moving first. And each night before bed, give your feet a gentle 3-minute massage, light circular strokes along the sole and up the ankle. Your nerves will respond. Sign number 8 tells me how far things have progressed. When I see this one, I know we're not catching something early anymore. And almost every time, the patient's first reaction is the same. Oh, I've always had cold feet. That's just me. I had a patient, a sweet woman named Carol, who laughed and said her husband had bought her heated slippers 3 Christmases in a row. We laughed together. But then I asked, Carol, are your feet cold in August? Cold even under 2 blankets when the rest of you feels warm. She got quiet. That's when I become concerned. Feet that are persistently cold, cold in summer, cold in a warm room, cold regardless of what you do to warm them, are a strong indicator of seriously compromised circulation in the lower extremities. Your blood vessels have narrowed or stiffened to the point where warm blood simply isn't reaching your feet in sufficient volume. Think of your circulatory system like a home heating system with pipes running to every room. When those pipes narrow from years of blood sugar damage, the heat doesn't reach the far end of the house. The room stays cold no matter how high you turn up the heat. That coldness isn't about the weather. It's about the pipes. The American Heart Association identifies peripheral artery disease caused by narrowed blood vessels as affecting over 8 million Americans, with diabetes being the single largest risk factor. Persistently cold feet are one of its earliest and most consistent symptoms. The best response here is a 30-minute brisk walk every day. Not a leisurely stroll, a purposeful arm-swinging walk. This pushes circulation into the feet and lower legs, strengthens blood vessel walls, and over time can begin to reverse some of the early narrowing. If 30 minutes feels like too much, start with 10. The important thing, start today. Sign number 9. This is the one almost nobody talks about. I have never seen it covered in a patient pamphlet. Most people walk right past it, and honestly, so do many doctors. But once you know it, you will never unsee it. During a foot exam, I look at the tops of the feet and the lower legs. And sometimes, there's a visible absence of hair in those areas. The patient looks down and says, I never noticed that. And that is exactly the problem. Hair follicles need a steady supply of blood and oxygen to function. When circulation has been significantly impaired by long-standing high blood sugar, the follicles in the feet and lower legs slowly stop receiving what they need. Over time, they stop producing hair entirely. Think of hair follicles like small plants in a garden. When the irrigation line narrows or gets blocked, the plants don't die overnight. They just gradually stop growing. The absence of growth is your body sending a message about your blood vessel health, a message you can see every single time you look at your own legs. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients and is a reliable, frequently overlooked sign that physicians are specifically trained to examine for. Right after this video, look at your lower legs and the tops of your feet. If the hair is noticeably thinner than the rest of your leg, or absent entirely, schedule a blood glucose test this week. Not this month, this week. It costs approximately $12 at any certified lab, and it's covered by Medicare for most of you. $12. That test could change the entire direction of your health. We've been through all 9. 9 signs. 9 chances to catch something before it catches you. And I want to be honest with you about something. One of the hardest parts of my work is sitting across from a patient who has had every one of these signs for 2 years and is only now finding out why. Not because they didn't care. They cared deeply. They just didn't have the information. You now have that information. And I want you to do just one thing with it. Tonight, before you go to bed, sit down and look at your feet. Take 30 seconds. Check the skin. Look between the toes. Feel for any numbness. Look for any wound that shouldn't be there. 30 seconds. That's all I'm asking. And if you see or feel anything on this list, call your doctor tomorrow. Not next week. Tomorrow. Because the earlier this is caught, the more completely it can be managed, often through a change in diet, a daily walk, and one honest conversation with your doctor. You have worked hard for the life you have, for your independence, your health, your ability to do what you love. Don't let something as manageable as blood sugar take any of that away simply because nobody told you what to look for. Now you know. If this helped you, share this video on Facebook right now. Tag someone you care about. A spouse, a sibling, a friend, a neighbor. You might be giving them something they didn't know they needed. And if you want more conversations like this one, I post a new video every day. Real health information for people over 55. The kind of thing I talk about with my patients every day that most people never hear outside a doctor's office. Subscribe and bring someone you love along with you. I'm Dr. Adriana Markson. Take care of those feet, and I'll see you in the next one.